Hello, my name is Dr. Scott Rahhal, and I am a fellowship-trained sports medicine surgeon at Eastern Oklahoma Orthopedic Center. And I specialize in treating knee, shoulder, elbow, and sports-related injuries and conditions. In this video, I will be discussing rotator cuff repair. The rotator cuff is a group of muscles that surround the ball of the ball and socket joint of the shoulder. Its function is to stabilize the ball in the socket throughout the full range of motion. When a rotator cuff tears, it pulls off the bone at the top of the shoulder. This can involve one, two, or multiple muscles of the rotator cuff. Rotator cuff tears can occur through a degenerative process or a traumatic process. Oftentimes, the tendon can become degenerative at the insertion site on the humerus. This can result in a tear of the rotator cuff, which can turn into a large tear. Also, the tear can occur through a traumatic event such as a fall or lifting something heavy very quickly. With a traumatic tear of the rotator cuff, patients will feel sharp pain at the time of injury. They will note weakness in the shoulder and an inability to elevate their arm. They will have weakness and pain even occurring at night when they try to sleep. With degenerative tears, their main complaint may just be pain, but they can still raise their arm. They will notice weakness with overhead activities and lifting away from their body. Pain at night is a mainstay of the symptoms noted with rotator cuff tears. For small rotator cuff tears, these can often be treated non-surgically with oral anti-inflammatories, oftentimes injections around the rotator cuff, and rehabilitation of the muscles that are still working. Strengthening the muscles is the mainstay of treatment for rotator cuff tears non-operatively. When non-surgical treatment fails, surgical intervention for rotator cuff tears is indicated. The surgical intervention requires an arthroscopic procedure to remove all the spurs that are impinging on the tendon, and then to repair the tendon back to the bone with anchors and suture. Following rotator cuff surgery, patients will go home on an outpatient basis. They will start a continuous passive motion machine at home to gain range of motion, as this is the mainstay in early treatment after surgery. They will not be allowed to lift for 6 weeks, but will start strengthening exercises at 6 weeks. This strengthening protocol will progress over the next 6 months. They will not be allowed to lift heavy until about 6 months post-operatively. They can expect to have some pain and achiness, which will improve on a month-to-month basis over a 1-year process. If you want to learn more about rotator cuff disease and surgical intervention, please visit our website at eooc.com. Thank you.